So if you're moving to the community, just so you know, there are services and support. We used to call them waiver services. And it's things like personal assistance. So it could be somebody who helps you transfer out of bed, shower, doing laundry, cooking, accompanying you when you go out to do shopping, things like that. There's also, for people when they're in the community, there's medical, which you've already got, and non-medical transportation. So this is transportation to go to things like religious services, or to go to, you know, maybe to the theater, or to visit family who's not so far away. The other thing is there's home modifications that can be available. So if you have a place that you are going to move into, maybe with a family member, but you wouldn't be able to move in because the bathroom's not accessible, that is something that you can ask the CHC plan to provide. And then there's things like Meals on Wheels, and there's a whole slew that they're listed on the side of this sheet you're supposed to get that explain like the types of services people can get once they're out of the nursing home to support people to be able to live independently. Okay, so the nursing home transition process, as I said, there's always been a process for nursing home transition, but it's never been through these plans. And you know, the state's hope is that it'll go more smoothly. I don't know if it will, but it's not good. Don't expect if you say you want to move out that it will happen quickly. It can take a long time, and I would say don't get discouraged because that can happen to some people. That, you know, because it just takes a long time. But you know, as long as the process is moving and not stalled, you know, it's something that you may want to pursue. And we're also, I put our helpline up there. It's on several places in this presentation. I bought a whole stack of cards with me that have our helpline. Call us if you have questions about this or need assistance. Okay, let's talk quickly about the CHC enrollment. We've answered some of these questions already, but we'll talk a little more. So, as I said earlier, there are 3 plans. Keystone First, PA Health and Wellness, and UPMC Community Health Choices. The deadline is November 14th to choose a plan. If somebody doesn't choose a plan, they will be auto-assigned to a plan, one of those 3 plans. There's a hard deadline of December 21st to change the plan if you want a January 1st start date. So let's say you're going along and you're like, okay, I think I'm going to choose UPMC. And then, you know, something happened and you got distracted and you started, you know, thinking about seeing your family for Thanksgiving, and all of a sudden, November 14th is gone and you get this letter in the mail that says you've been assigned to Keystone First. Well, you still have time until December 21st to change that selection. And let's say in February you say, I kind of like this UPMC plan. I want to try a different plan. You can still do that as well. Okay. All right, so we already touched on this. I just want to sort of reinforce it. To choose a plan, you're on Medicaid only. Make sure all your providers that are specialists and outside of Inglis House are in the plan, and check if the key prescriptions are on the formulary. The dual eligibles, if the providers are in the plan, great. If they're not, okay, you should be fine. And we want to hear about any issues with being able to continue to access your same providers if people are on Medicare. Because there have been, you know, we want to make sure this goes well. So if you can get your providers in the network, great. If you can't and they're Medicare providers, it should still be okay, as long as they build a plan. And everybody consider some of the perks, and here's a few of them. There's an eyeglasses allowance in one of the plans. There's extra dental allowance in one of the plans. And the nursing home transition benefit, as I mentioned, can be broader or narrower. And here's how to enroll. Okay, so there's an entity called the Independent Enrollment Broker. You might see it as IEB, or you might see it as Maximus, which is the name of the corporation that owns it. They're the ones who are processing these enrollments. There are 3 ways to enroll. One is to call. And the phone number's here, and it's also in the documents you've been getting, or hopefully been getting. You can also enroll online through www.enrollchc.com. And you can mail in the enrollment form that you got in the mail. So those are the 3 ways to do it. Maximus has on its website a provider search tool where you can go in and put in the names of providers and see what plans, networks they're in. I will warn you right now, if you're entering the name of a provider, as of today it says primary care provider or PCP, as if you couldn't search for others, but you can. It's just wrong. I searched for a specialist the other day and it came up. So you can search by provider name. You can also call providers and ask them if they're participating in a network. Sometimes they don't always know. Sometimes it's really the billing people who know. Not necessarily the nurses or the social workers or the doctors themselves. You can also call the individual plans or call Maximus to ask if providers are in what networks. If you have problems getting information, call our helpline and let us know, because we're reporting issues back to the state. So if you call Maximus and they say, we can't look up specialists, we want to know about that, the independent enrollment broker. And if you can, remember, take down the name of the person who said it and the time of the call. Now, plans and Maximus are supposed to make their materials accessible and available in other formats for people with disabilities, so large print or Braille, or sometimes people will use a CD with large print or audio. If you have trouble accessing these things, we want to know that as well. We did have an unfortunate incident where somebody called Maximus to get something in large print and they said they couldn't do it, which is not true. So if there are any issues with the enrollment, really any issues with CHC at all, please call us. And I'm saying this, we get many, many calls on many, many Medicaid issues, but this is something we're really keeping an eye on. So even though we're inundated, this is something that we're spotting these calls and pulling them forward when you call. Now, what if somebody who is at Inglis House, who's a loved one or someone you care for, can't pick a plan on their own? So if somebody doesn't choose, they will be auto-assigned, which is not ideal. There are other people who may be able to pick or change a plan on a resident's behalf if they have authority, and that includes somebody with power of attorney, or a guardian, or somebody who the person has previously said is their authorized representative. Now, I know that I said that when you're enrolling, there's a form you can use, or you can do it online. If somebody can't sign, they can use their mark, or they can do something over the telephone. And Maximus has said the independent enrollment group is supposed to come and do in-person enrollments for people who need that as well. There's another thing is when you're in Community Health Choices, once the plan is selected, you want to talk to the plan if you want to get copies of what your loved one's receiving, because the Inglis House gets stuff, but you might want to see what they're getting as well. The participant, the person who's in the CHC plan, they can indicate another addressee to get copies of notices. So I'm going to recap. You have to pick a new CHC plan for your Medicaid. And you can follow the instructions on the enrollment packet or on these slides, which you will be getting, to contact Maximus. CHC changes how Inglis House gets paid, but you don't have to change nursing homes. Inglis House got this. It's going to be fine. They're either going to participate with all the plans, or the plans are going to just pay them anyway. Your Medicare is not changing if you have Medicare. And you shouldn't have to change doctors if you have Medicare. But if the doctors are in the CHC plan network, yes, it may mean fewer headaches. If you have only Medicaid, CHC changes how your doctors get paid. So you want to make sure all of your doctors are in the CHC plan network, and the prescriptions, especially the key ones, are on the formulary for the plan you choose. And if you are interested in leaving the nursing home, you can contact your Community Health Choices plan for nursing home transition services. So when you get copies of the slides, there's going to be a list of contacts towards the end, and it's Inglis House, of course, can help connecting you with other resources, and there are also going to be these workshops on enrolling and helping you identify which plans make sense. There's a number for Maximus. There's also a participant call center, which is run by the Department of Human Services, which is overseeing this whole thing. So if you have complaints, call that number, or if you want additional information. And then for those people who are on Medicare as well, if you have questions about Medicare coverage and options, because Medicare also sends a lot of mail, and right now, so if you're trying to figure out like what all that's about, call a Prize, which are counselors who work with people who are Medicare to help them make Medicare choices. And then finally, I do want you to call the Pennsylvania Health Law Project helpline. Really, if you want to understand CHC, if you're having problems, if you went to a doctor and they said they couldn't see you because they don't accept CHC, even though they're going to take Medicare, if the nursing home transition's not working, somebody denies you a service or item you wanted, call our helpline, please. If there's one thing you take home with you is you can call. And then that, because we're a law firm, that's one-on-one counseling or representation, so it's all confidential, which is why I don't necessarily want to do personal questions here, but I want you to know that you can call and it's all confidential.
Can you go back one slide?
Yeah. I'll keep this up. So are there other questions? And I'm going to hang around. The next session's at 3? Yeah. 3. So I'm going to hang around to answer individual questions too. But if you have general questions, please go ahead.
Do you have the enrollment sheets that pays out?
Those are, the Inglis House is getting them.
The enrollment form, yeah.
Oh, the forms? The enrollment forms were supposed to come in the mail, in a letter. They had the participants.
I got the letter, I didn't get a form.
Okay, I'll look at them.
Here, I would need Green to sign it.
Okay, we can talk about.
I would need a legal person to see your sign it.
Yeah, the forms were supposed to come directly with the enrollment packets, and they had like the individual's information on them already pre-printed. So if you don't have those, and if you didn't get an enrollment packet, then the Maximus, the independent enrollment broker, is the number to call and say I didn't get the packet.
Or you can enroll online. And that has to be done by the 14th.
It has to be done by the 14th to avoid getting auto-assigned, but since it doesn't start till January 1st, there's still until December 21st to change. Yeah, if you miss November 14th, December 21st is the hard stop. I'm sorry?
If it's not done by the 14th, you're enrolling her. I don't know anyone.
I'm not enrolling her. I don't work for the state.
Well, they are.
They'll enroll, and then that can be changed by December 21st, or at any time next year.
Where if I have the form, all I have to do is get something to see that she signed it. Question?
Yeah, I have a question. I did receive a form, but I misplaced it. But can I still apply for it online?
You can definitely do it online, even if you lost the form. And you can call up and have them send you a replacement form. But honestly, online is probably the fastest. Or you can call.
So when I apply online, you can do it on the computer, or you can do it on your smartphone, or is it on the computer?
I have never tried to access the website on my smartphone, so I don't know how user-friendly it is.
Yeah.
on a smartphone.
I would go to on a computer, it's
Yeah.
probably easier.
And then once I fill that out, then I can get the hard copy out, right?
Yeah, or you could just, once it's filled out, I mean, I haven't done the enrollments online, so but I assume you get a confirmation saying that you're in this plan. And that should happen, if people enroll now, sometime after November 14th, the deadline, you should get a confirmation letter saying you've been enrolled in such and such plan. Either because you selected it, or because you didn't select the plan and they just chose one.
But when I filled it out, anything, if you want to print, can I print out all the work I've done, so I can show proof that I did do it? You know, hard copies?
That's a good question. I've never gone through that process. I don't know how it works. You might be the tester of that process.
Yeah.
You can always do a screenshot, like a save the screen or screen print if you're using it on the computer. It's a really good question, and I'm going to follow up with the state, but I can't imagine there's not a confirmation, but
Or a confirmation email at least.
or something.
Yeah.
But
I just want to have a copy of a hard copy of
Yeah.
what I did on it.
yeah, I unfortunately just don't know the answer to that question.
Did you do it yet?
No, I will.
Are you gonna do it in the lab?
Huh?
Are you
Yeah.
gonna do it? Ask the lab staff to help you do print screen,
Oh,
so you
okay.
can get it, okay?
Okay.
They'll help you.
Okay.
Okay.
I'm taking a note of that. That's a good question, though.
Keep backing up. You're gonna hit that hole.
Tyrone, be careful behind you, mine's behind you, okay? Can you scooch up a little?
Any other?
Getting up.
I'm still taking questions.
Good, right there.
I'll take questions for another 15 minutes, and then I'll take individual questions if you like.
I don't know if anybody else cares about this. Is this program statewide?
Okay, yes, no, it's a good question, and I didn't include it. So the way this program's working is it's rolling out across the state in stages. So what they did first is it actually started last January in the southwest in 14 counties, or, around Pittsburgh and then 14 counties around there. And now on January 1st of this 2019, it's going to be in Chester, Bucks, Montgomery, Philadelphia, and there's one other county I always miss. Delaware, thank you. Delaware. And then, so that's good, they call it Zone 2. And then the rest of the state, the sort of T in the middle, is going to, going up to the north, is going to be done January 1st, 2020. Yeah. So if you know people in other parts of the state, they also, it's coming. You could let them know. Do we have other questions? I don't have that. Go ahead,
If somebody's on Medicaid only, I'm concerned about the doctors. Is that going to change? I don't understand that.
Okay. So, it's not, what's changing is who the payer is, okay? So Medicaid's paying right now, and if a provider accepts Medicaid, the access card, then people who get Medicaid can go to that person. What the doctors now, working with the plans, are doing is they're deciding whether they want to be in the network of a plan, and they're talking to all three plans, hopefully, and deciding which ones they want to participate with. And the plans are deciding whether they want to participate with those doctors, and they have contracts. So it's possible that you said was it your son? Yes. That your son is, if he's on Medicaid only, he might be seeing a doctor who is going to participate with PA Health and Wellness, but not the other two. Or who's going to participate with PA Health and Wellness and Keystone First, but not BPMC. Or maybe they'll do all three, or maybe none. So if you're going to want to make a list of the doctors and find out which plans they're in, and see if you can get them all to have that in one plan.
Let me just give a little additional. So Inglis has been reaching out to all of the providers that
work with our residents here, the providers that come to Inglis. So we can't control if they get themselves credentialed. We are reminding them, encouraging them, pushing them. We have sent letters. We are doing everything that we can to say you need to be credentialed with, we think and we recommend, all 3 of the managed care plans. We do not control that. If they choose not to get credentialed, Inglis will then have to find additional providers so that can work. If residents are using providers that are outside of the network, that's still, again, we can't control the credentialing process. What we are finding is, and we are hoping that all of the providers think about this and get themselves together so that they get themselves credentialed before January 1. If they don't, because if you go onto many of the provider websites to look at the list of doctors that are available, there's not a lot there because they haven't, it's one of the things that all the MCOs are saying. They are trying to reach out to providers in the area and say, get your act together and get your credentialing papers in so that we can get you into the networks. Inglis unfortunately controls that in no way, shape, or form. We have no control over that. We can only control the docs that come to Inglis and the specialists that come to Inglis as part of our clinics that we set up and are making sure that saying as a requirement for continuing to work here at Inglis, you must get yourself credentialed. So we can say that, we can.
But how long can you wait to fill out this enrollment?
You have to enroll. I mean, you want to talk about the,
Okay.
you have to enroll still, but then you can change your plan.
Does anyone have other questions? No other questions? Okay.
Thank you.
Well, thank you all as well. I am going to stick around and answer individual questions if you have them. I have a card which has our helpline number on it that I'm going to go grab right now. So I hope this was helpful, and please, once you see our helpline number, please call if you have questions.
I just wanted to say thank you, and we are having another session starting at 3 o'clock. But to just remember that this is a mandatory thing that the state is saying, that this is coming to the entire Commonwealth of Pennsylvania. Inglis staff cannot tell residents, suggest to residents, select for residents which plan to take. We can only guide, provide answers. Here's the information. We'll help you go through the process, but you have to make, you as the resident or you as the family member or guardian, have to make that selection yourself. Our staff, Inglis staff, cannot do that. We are not allowed by law. So even if someone says, oh, you just pay for us, we cannot do that. So we are trying to do these kinds of sessions, and our staff are setting up the enrollment workshops as a benefit to try and make the process, which is confusing and convoluted, easier, as best as we can. So we're all trying to go through this together. We're all trying to make it an easier and more helpful process. And so we ask you all to just bear with us as we all try to get through it. And we're giving information as we get it. As information keeps changing, we try to push it out and share it. Okay? Thank you all.